инновации для эффективной нейрореабилитации, основанной на знаниях. И на сцену приглашается директор Университетского центра нейрореабилитации Института Гуттман, Испания, доктор Хосе Мария Рамирес и координатор по научно-исследовательской работе доктор Хосе Мария Тормос.
Hello and good morning to everybody. I am José María Tormos, Research Coordinator of Institute Gutmann. And further than nothing, I want to thank to Альфамед the opportunity to come here and to explain you what we do and how we do it in the Institute Gutmann. And also to apologize for not being able to speak in Russian. I will try to do my best in English and speak quite clear in order that the message can reach you. So Institute Gutmann, it is a leading hospital in the medical treatment, surgery, and full rehabilitation of patients with a spinal cord injury, brain damage, or any other disability from a neurological origin. The topic of my talk, it will be very focused on something that we have learned from a Russian scientist, from Alexander Luria, who teach us how we can, departing from knowledge, help people that are suffering, but learn about that knowledge and being able to communicate to others. So is what we have defined in the language of our times as a strategic innovation for an efficient and knowledge-based neurorehabilitation. So Institute Gutmann, it is an almost 50-year hospital, and it was promoted by a Catalan person who got a spinal cord injury. At that time in Barcelona, neither in Spain, neither almost in the world, there was very few opportunities for people suffering from a spinal cord injury. But he was from English origin, and he knew that in England at that time, there was a German neurosurgeon who moves to England because of the Second World War, and he was Ludwig Gutmann. Ludwig Gutmann changed or dramatically changed the prognosis of spinal cord injury and promote the modern concept of comprehensive neurorehabilitation. Our organization, it is a non-profit organization, and it's run and driven by several people from the civil society in Catalonia, and we are we are an organization who are very, very much oriented to our cooperation and the collaborations beyond boundaries, and because of that, we have accredited by the International Joint Commission as a standard of quality. The Institute Gutmann, we do mainly 4 things: healthcare, research, teaching, and actions oriented to social and community services. From the point of view of healthcare, the Institute Gutmann, or the goal of the Institute Gutmann, is to provide the most comprehensive, customized, and specialized medical and rehabilitation care at the highest human and scientific level. We are a small hospital, much smaller than this, a 150 beds hospital, and we are altogether 400 people working oriented to provide help to people that has needs. So these 400 people every year attend around 5,000 people. We give, the last year, we provide almost 800 discharges. We attend 3,500 people at the ambulatory facilities. And what is more important of this is that almost 1,000 people were new patients. One of the characteristics of the Institut Gutmann is the concentration of patients with the same kind of problems, and because of that, the concentration of knowledge. Something very similar to what Professor Luria was exposed when he was working. And we have a budget of 25 million euros, what is a small but considerable amount of resources put at the service of neurorehabilitation. As we were telling you, the thing that we want to remark is the advantage and the importance of the concentration of cases in neurorehabilitation. The traumatic brain injury and spinal cord injury are very rare diseases. This is because they origin or cause disability. But the cost of this disability is very important for the society. So neurorehabilitation is oriented to decrease the impact of the injury. And in order to decrease the impact of the injury, you need to be efficient and work properly. And then you need teams of people very well trained in this specific knowledge. And this is because we, in our experience, the concentration of cases, it is so important. So how do we do in the Institut Gutmann? How we work? And we work in some kind in the same way that has been explained in the first talk, but we want to remark a very important thing, and it is this model centering the patient. Okay, we in the Institut Gutmann, we organize as an interdisciplinary team formed by a rehabilitation physician, a nurse, the physiotherapist, the occupational therapist, the psychologist, or the neuropsychologist, depending on whether the patient has or not a cognitive impairment, and the social worker. The team is led by the physician, by the medical doctor. And every time that a patient is admitted at the Institut Gutmann, it is assigned a team formed by each one of these roles. And this team will be the responsible for this patient. This regarding many other people will contribute to the treatment. But the patient, the family, and all the surroundings will know to whom address in order to get information and in order to interact. So in this way, the interdisciplinary team is oriented in three main units: the spinal cord injury unit, the brain injury unit, and a functional unit for child rehabilitation. And these units, led by the physician, are interacting with a series of transversal facilities as rehabilitation nursing, physical and occupational therapy, speech language and psychologists and neuropsychologists, all the resources or the complementary resources like imaging, laboratories, pharmacy, and all the other specialists. But the idea it is, or we bet for the transversality in the organization of the team. The rehabilitation specialists, as I was mentioned previously, are the lead of the rehabilitation team. They are mainly formed by specialists in physical medicine and rehabilitation, but we also have in the team of physicians, neurologists, traumatologists, and all the key complementary specialties in neurorehabilitation, as well as a group of consultants that allow us to act in a comprehensive way in order to provide or to cover all the necessities of the patient. Rehabilitation nursing, it is really, really important in neurorehabilitation. I had the opportunity to talk with one of the last direct fellows of Professor Ludwig Gutmann, and he explained it to me how he get up at 4 o'clock in the morning in order to lead the work of the nurses and do the mobilization of the patients in order to avoid SORS, and by avoiding SORS, avoiding infections, and by avoiding infections, building up survival after spinal cord injury. So the nursery team train people the skills in order to cover all the activities of daily living. They are very important in order to provide emotional support. They are very important in order to train patients and relatives how to compensate disabilities of the autonomic dysfunctions, and they are also keystones in order to elaborate the discharge plans, in order to teach the people how to deal with disability once they be out of the neurorehabilitation hospital. The physical therapy is another very, very important element in the team, and any patient that be able to do it will complete a program of 5 hours per day of personalized activities. This personalized program of activities came out from the assessment of the patient's functional profile by the physical therapist, and all the program can combine hydrotherapy, compression, exercise, massage, joint mobilization. I mean, a full portfolio of activities. The occupational therapy is also a very important actor into the team, and the goal it is to maximize patient autonomy at home and in the community. So in addition to interact daily with the patients, we also organize activities out of the hospital in order to promote the resuming of their life after the inpatient phase. Another thing that is very important in neurorehabilitation, it is to understand that together with the physical impairment, that is the most obvious deficit in many things, in many cases, almost in every cases, in people with brain injury, there are also cognitive impairment. And this cognitive impairment can be even more disabling than the physical impairment. So we have a structure, a unit that counts with a neuropsychologist and a speech pathologist that cover all the elements necessary for the comprehensive rehabilitation program. And last but not least, it is the social work and vocational training team. Social workers start their work not at the end of the process, but at the beginning of the process, because one of our aims, it is to maximize the opportunities, the chances of people being able to go back home, because it is the most normalizing situation. And because of this, they start to interact with family and the family, the patient and the family, shortly after the admission. And they are focusing to arrange home care services, to deal with insurance benefits, counseling, support, and also the identification of potential opportunities in order to resume their active life. So in this way, the activities of the Institute Gutmann, or the service portfolio, is oriented into the acute phase rehabilitation with the intensive rehabilitation program, but also what we call the monitoring and maintenance phase. In this way, patient is able to come to the hospital every 2 years in order to do a comprehensive assessment again, identify complications, identify potential complication, and install preventive measurements, and treat with all complication after the rehabilitation phase that could appear. And this is also all the functional programs that are very specific programs based in technology or in personal interventions with the patient in order to fulfill the complex problem of neurorehabilitation. So I explained what is Institute Gutmann as a healthcare facility, and now I'm going to explain what is Institute Gutmann as a research, teaching, and innovation center. And I don't mistake and put the wrong picture. It is the same facility and the same professionals, the same 400 people doing the healthcare that are the protagonists or the actors of the research, teaching, and innovation activities. So, as a research institute, our mission is to develop the academic, scientific, and research aspects of neuroscience in general, and neurorehabilitation, and technologies applicable to the autonomy of the persons in particular. Who do we do this? So, basically the idea is to depart from problems and identify what is the problem and start looking for solutions, for already invented solutions. And only in the case that there are no solutions, that we try to invent what we could do. And what we really focus in a translational research approach, it is to implement the new potential solutions in such a way that we can objective results to know whether we are helping or not to the patient, and to understand why are we helping, what is more or less relatively important. I mean, if it goes well, who cares? But also to understand why are not helping, and to discover new problems and to look for new solutions. So the idea is basically, or the objectives is based on the instrumentation of rehabilitation, improve efficiency, generate objective information, improve patient and the therapist relationship. One of the ideas is when you introduce a machine or a device in the neurorehabilitation process, you are not separating the patient and the physician or the therapist. You are providing information, and this relationship will be stronger. Basically, is to identify the unmet needs and to generate innovation processes and solutions valorization. And I mean, we believe that the hospital can be a source of knowledge, but also an agent in the dynamization of valorization and economic and extract economic value for the commercialization of these solutions. So as you saw, the organization of the research is very similar with the organization of the clinical activity. There are two main lines, brain injury and spinal cord injury. The head of each clinical unit is the head of each research program, and there are several transversal programs that cope very well with functional rehabilitation professionals, with neuropsychologists, with social workers, in order to promote innovation in all the areas of the clinical activity. Basically, in bioengineering applied to autonomy of persons, we are oriented, or we focus our activity in monitor patient activity. We have a quite complete motion lab analysis laboratory, and with kinematic analysis, dynamic electromyography, biorecording, and we also have a quite good armamentarium of robotic assisted devices. Why? Because this allows us to be more to provide more intensive training, but also to monitor the performance, to give patient feedback and motivate them, and to homogenize interventions, to know what patients are doing, and to know that the patient with a similar problem are having the similar treatment. And the objective of these two key actions, it is to add resolution to the understanding of the problem and become a better partner for technological agents, companies, research centers that can understand better the problem and provide us better solutions that we can implement together in order to speed up all the process. We have also a program oriented to neurostimulation, neuromodulation, and non-invasive brain stimulation. And this is because one of the aspects is that when the brain has an injury, or the nervous system has an injury, it can reconfigure. In fact, it reconfigures because the nervous system is plastic. Many times it changes well, and you can recover functions. But the most of the times, it doesn't know how to change, it don't change properly, and you get chronicity, and you get disability. And with rehabilitation, you can drive this possibility of change of the system. But if you couple the rehabilitation techniques with transcranial magnetic brain stimulation, for instance, guided by neuroimaging, you can couple a speech therapy for the rehabilitation and the aphasia, try to promote the reorganization of damaged areas in the left brain, but also inactivate areas that are wrongly working too much, and by decreasing the activity of these areas that are working too much, allow the damaged areas to reorganize better. And you can also combine visual illusion, as Ramachandran showed 30 years ago, in order to treat neuropathic pain. But if you combine this visual illusion with brain stimulation, with transcranial direct current stimulation, you can see how the effect is higher and more robust. So the idea of this program is try to combine standard rehabilitation procedures with non-invasive brain stimulation techniques in order to optimize outcome. Another area of innovation in that we are working is to see how information and communication technologies can help us to be much more efficient in cognitive rehabilitation. And in order to extract all this benefit, we have developed a computerized cognitive telerehabilitation platform. That it is not a computer game. It's more than this. It is a new method for provision of neuropsychological rehabilitation services. I mean, is once you have seen the patient, once you have diagnosed what is the deficit of the patient, then you can define a personalized therapeutic program for the patient that the patient can complete every day at the hospital, at day centers, at residences, or at home, and they can do it there at the time they prefer, and you are, but they are doing what you have already prescribed, and one of the advantages of the system is that it's tracking anything that the patient is doing. And it's giving you the information whether the patient has or not done the exercises, whether the patient has do the exercises well or not, and all this information, it's something that we are putting together at the service of the clinician in order to know how his patient is doing and how his hypotheses were right or wrong, but we are also putting all this information because of a center database at the disposition of this and other patients. And the way that we do this, it is by applying an artificial intelligence layer that extract the knowledge of what exercises for which patients are better, what exercises provide more functional autonomy in such a way that any time that at this moment a physician introduces a new patient into the systems tell the physician, the therapist, how many patients like this are already in the patient, which are the more suitable exercises for this kind of patients, and even though the therapist has the opportunity to modify and to add to the knowledge, the knowledge of the evidence, to add his own knowledge because he is the one who knows better the patient. So, because by this way, we optimize time of health professionals, we increase the personalization of the treatment, we automatic monitoring because everything is transparent for the professional and for the patient, we provide results in real time, we generate clinical guidelines and knowledge. And even though all this makes clinical research easier. The other area that we are working intensively, it is translational research program for regenerative medicine applied to spinal cord injury and brain injury. And I think that this is a model that needs to be promoted in neurorehabilitation center. Because at this moment, there exists still a gap between bioengineering and cell therapy research and clinical application. And part of this gap is not from the side of bioengineering, it's by the side of neurorehabilitation, because we still only have 3 kinds of patients: spinal cord injury patient, brain injury patient that can be a stroke, or traumatic brain injury. But all we know that all these 3 cases of patients has a lot of heterogeneity within them. And we know very well the subtype of tumors, for instance. And we know very well even the genetic profile within each anatomopathology of tumors. And we have very, very few information about what is going on within these 3 branches of patients. So what we are working, it is to set up a protocol that allows us to know very well the clinical profile of each patient, as well as the subclinical profile, neuropsychological information, neurophysiological information, information from neuroimaging, information from the evolution of the patient at the most detailed level. It is what we consider that will put us in an strategic advantages in order to cooperate with laboratories for bioengineering. And the last but not least research program, it is what we call laboratory for promoting autonomy of the patient. And this program is in order to solve a problem that we create ourselves when in 1993 we introduced the electronic clinical records in the Institut Gutmann in order to gather information. And in 2005 we end up with a huge amount of data, but still very few information. And what we have done is to introduce data mining and knowledge discovery in databases and artificial intelligence technology in order to extract the knowledge hidden in those data and take information of what is going on within the process of neurorehabilitation. We are collaborating, for instance, with the World Health Organization in the elaboration of the core sets of the international classification for functioning and disability for the spinal cord injury and for the traumatic brain injury. And all this, it has been that during the last 11 years, we have worked in almost 200 research projects, 252 research studies, with almost 200 scientific publications and more than 500 communications to medical congresses as well. And we have worked and we are still working in the elaboration of 35 doctoral theses. Sorry. So, and all these, I mean, all what I have explained, it could be not real because it's many things for only 400 people. And the reason because of I'm not lying and it's all true, it is because of everything that I have explained, we try to do in an open collaborative network model. I mean, many of those, more than these 200 projects are collaborative projects. And at this moment, after 12 years of intensive activity, it ends up a network of more than 70 centers in which we are collaborating, and more of them as hospitals, more of them as universities, technological companies, or technological research centers. And this is in order to show you that we love collaborating with people and we love a partnering. And I'm finishing my presentations talking about or mentioning also the teaching activities. We have two master degree programs from the European Common Credit Transfer System, from the European Space for Higher Education. One master in neurorehabilitation, another one in neuropsychological rehabilitation and cognitive stimulation. And we also provide a title of expertise in neurorehabilitation, like the model of a fellowship oriented to professionals and specialists that won't come to the Institut Gutmann during a year, get integrated into the hospital activity, learn the model, and go back to their area and try to implement it. And the end is that what it many times happen is that you can have a huge amount of effort put in research, but at the end you can see this is like a marathon. Okay, you run 42 kilometers and you see the banner of the kilometer 42 and you are not at the finish line. You need to run a quarter of kilometer more. And this quarter of kilometer is critical, because if not, you haven't run the marathon. And you are exhausted, and you believe that you have no more energy, but you have to do it. And this quarter of kilometer is called innovation. And it's how can we transfer to patient all this information, all these devices, all these facilities that we have founded. And in order to do this, we have had to invent. And what we have invented is something called Gutmann Innova. And it is a special program in order to introduce all these new advantages. I mean, specialist neuroorthopedic techniques, non-invasive brain stimulation, in aphasia, in neuropathic pain, all the things I have explained, at the end, needs a special program, because we physicians are what we say in Spanish, animal de costumbres. We are very used to our own procedures. It costs a lot to change. And in combination with this website, in order to communicate the innovations programs and to put it closer to the patient, we have done 3 more innovative actions. One is what we call Gutmann Neuropersonal Trainer. It is this platform of cognitive telerehabilitation that is very useful for us, that has allowed us to treat more than 1,000 patients, and that is very good in order to provide cognitive rehabilitation in an efficient way. It's just to convert into a product in order that people in other places can use it, and that more people far away from Barcelona can get benefit from the system. And also what we call Gutmann Neuropersonal Clinic, and a specific clinic space within the hospital in order to promote and speed up the launch of all these and to explain the new delivery care models: problem-oriented, focus on personalization, intensive treatments, innovative technologies, differentiation, proximity, and availability. I mean, patients are disposed to travel a lot to find a solution, but it will have much more sense to get the solution closer to the patient. And the last one, it is Gutmann Neuropersonal Rehab. What is Gutmann Neuropersonal Rehab? This is a bet for what is called at this moment open service innovation. We know something. We don't know everything, but we have some knowledge, and we want to know more. And we have learned that the best way in order to learn more is to share your knowledge. And Gutmann Neuropersonal Rehab is an offer to centers that can be or that want to be specialized in neurorehabilitation to share knowledge, to share protocols, to share procedures, and to share also results. And the only condition is that they want to be specialized in neurorehabilitation and characterized by therapeutic innovation and clinical excellence. And all these things we do trying to give our best to our patients and to our partners. And because of that, we implemented a total quality management program as a global concept. And this is because I mentioned at the beginning the idea of getting accredited and to get in within the networks. So we have a leitmotif in our organization that is helping to start new lives. And we do all together with these people, with many other people, and we will love to do it even to do something with you if you are interested. So thank you very much for your attention.
Тормоз. И продолжаем дальше.